So what happens is we have to inject the dye either peritumorally around the tumor or in the periareolar region, and around 3 to 5 ml of dye is injected before the surgery. On the day of surgery, before the surgery, we inject 3 to 5 ml of dye, and then do 5 minutes of massage in the breast so that the dye can easily flow into the from the lymphatics into the axillary lymph nodes. As far as the nitrogen technetium radiolabeled sulfur colloid is concerned, it can be injected either day before the surgery. On day before the surgery, when we use the dose of 2.5 millicuries, so we inject a day before surgery if we are using lymphoscintigraphy. So if we are using lymphoscintigraphy, then we inject 2.5 millicuries of this radiolabeled sulfur colloid a day before the surgery, or we can inject 0.5 millicuries on the day of surgery. On the day of surgery, if on the day of surgery we'll inject if we are not using lymphoscintigraphy. Now what happens is, how do we plan an incision? So once you injected the dye, we with a handheld gamma probe transcutaneously we'll see the area of increased radioactivity. So transcutaneously we see the increase of radioactivity, and according to this increased area of radioactivity, we are going to plan our incision. So we plan our incision by seeing the increase in radioactivity or increased area of radioactivity. Once we give the incision, again we are with the handheld gamma probe, we will again look for the increased radioactivity, area of increased radioactivity. So nodes with increased radioactivity, they'll be basically called as a hot nodes, and they will be the sentinel nodes, hot nodes. Plus, along with that, we trace the blue lymphatics towards the blue node. We trace the blue lymphatics towards the blue node. Okay, so that is how we basically trace a sentinel lymph node. Okay.